Hi, this is Dr. Reken at Reno Sparks MedSpa in Reno, Nevada. I'm here with Maria, and Maria's had a trigger finger before. I've been seeing her for a few years for various problems, and Maria's trigger finger was injected by me, and this was done on about March 6th of this year, and we're now here at the end of November, and so it's been almost 9 months, and she's had pretty good relief of her trigger finger during that time. And so this is the middle finger, sometimes called the third finger, and her triggering occurs right here. And it occurs because there's a pulley system in the finger, and so if you trigger at this site, then the injection has to be about here. If you trigger here, then the injection should be here. And if you trigger here, the injection should be about here. But the concept for a trigger finger injection is basically the same for all the fingers and the thumb. And I like trigger finger injections a lot, and the reason I like them is the relief tends to be pretty rapid, and the triggering usually stops completely within a week, in my experience. The typical patient is going to be somewhere from 6 to 18 months trigger-free, usually once that calms down. I usually use about 20 milligrams of Candela, does the job. Put a little lidocaine in there, calms it down. It's a little numb for a while. So let's see if we can get her to trigger. Maria, can you close your hand for me? Cierra sus manos abierto. Okay, and you saw that kind of locked right there, and she's just kind of locked there, and I have to, and go ahead and do this a few times, Maria. Notice how it sort of popped open suddenly. So that's the triggering. You can see that there's some goop on there because I went ahead and put some numbing cream on it. This is a tender area, so the injection hurts a little bit, so I'd like to put a little local anesthetic on it before I stick a needle in it. Makes it more comfortable. So now it's somewhat numb, and it's clean. And so now we'll have you put your finger down here. All right. Are you ready? Okay. On the count of 3. 1, 2, 3. Doesn't need to be in very far. And you can see that that's kind of poofy if you compare it to the fingers next to it. It's a little bit swollen. And if you look at that area, it sort of fills up that area. Now you don't want to inject in the tendon, so when you inject, it's kind of, I explain this as sort of like you're in the tendon sheath. So pretend that this is a handbrake on a 10-speed bicycle. So here you are with the cable, and then you have the cable housing. The cable housing is plastic, the cable is usually metal. So here's the cable, that's the tendon, and here's the housing, the tendon sheath around it, okay, like a hot dog in a bun. And so what I'm injecting, when I inject, I want that needle to be right in between them. I don't really want to be in the tendon, but I don't want to be outside the tendon sheath because the inflammation is inside there. So if I can get to this area, and if I inject and it's too hard to push, it's in the tendon, and I pull back a little, and then I'm in the tendon sheath. And that's kind of how the injection works. And let's hope she gets at least 9 months of relief from this one like she did from the last one. Thanks, Maria. I appreciate it. This is Dr. Reken at Reno Sparks MedSpa. Stay healthy, and if you're not, we're always here for you.